to compare the real surgery with a group of patients having an anesthetic and an incision, but not having the spur removed.
Can you talk a little bit about how you enroll individuals in a study like this and who signs up for this?
And how do they sign up?
Well, they sign up through a process of informed consent. So very careful discussion is made with the patient. But before we got to that stage, we had to meet with ethicists, we had to meet with our ethical review board, we had to define exactly how we were going to describe the study to the patient.
And Dr. Carr, the placebo effect is anywhere from 15 to 72% in studies. And it's not just a perceived benefit. There are studies that have shown, for example, that asthma patients after taking a placebo pill will actually experience less constriction in their bronchial tubes. And so we're talking about a very real thing that may be happening that is for the greater good, because you could be preventing so many patients from having an unnecessary surgery that's not even effective for them.
Are they being reimbursed? Are they being compensated in some way?
No, so they aren't being reimbursed. They are part of the NHS treatment system. They don't pay for the surgery, the NHS pays for the surgery, and they don't get personally reimbursed.
Do you agree to a surgery and there's a chance that you're not having anything done whatsoever? Isn't it assault and battery of sorts?
The view we took and the view we came to with our patient advisors and with our ethicists was that it was actually unethical not to do the trial, not to do the study. So in the United Kingdom, 30,000 of these operations were being performed a year before we did the study. We did the study, we showed that the outcome for the patient was no different between having the real surgery and having the placebo surgery. As a consequence of that study, rates of surgery have dropped to less than 3,000 per annum now.
So your study actually was able to prove that the actual surgery provided no benefit as compared to this placebo surgery. You saw a drop in surgeries in the UK. I want to bring Dr. McCary into the conversation. These results obviously should translate to the US, where the same surgeries performed quite a bit. Have you noticed, Dr. McCary, have surgery rates dropped here in the US?
Well, by and large, they have not as a result of these placebo-based trials. So ironically, we're putting patients through surgery they don't need for the sake of generating science and evidence. But once we generate it, the practice has by and large been unchanged. Take, for example, the knee arthroscopy procedure that's very common called a meniscectomy. It's not an ACL, PCL repair. This is different from a ligament repair. This is putting the scope in and washing the cavity and maybe shaving the side of the cartilage. That procedure has zero benefit. They've done the placebo-based trial. No benefit, and yet today in the United States, we do 750,000 a year. It is one of the most common orthopedic procedures in the United States, despite the hard evidence that it does not work in the vast majority of indications, which are 99%.
On top of that, that arthroscopy can cause significant harm. It happened to me. I ended up getting a knee replacement because somebody said, oh, we're going to do a scope, nothing. We're going to clean up your meniscus. We're going to rotor your joint space. Well, guess what? Lost the cartilage, ended up with a knee replacement that in my mind, I don't think I would have needed if I hadn't had that scope in the first place.
And Dr. McCary, to that point, this is really disturbing. I was very shocked to learn that it takes 17 years on average for the evidence base, for these scientific studies to actually start to impact the daily practices of providers. So what's your opinion on that? And what can we do to close that gap?
Look, these randomized control placebo trials were really designed for drugs. They were designed to look at placebo medications. Unfortunately, some doctors feel like we have to do this in order to change the practice. They're done. I'm not saying it's unethical. I'm saying, look, it's really pushing the envelope of ethics. But even when we get the studies in the United States, we're not seeing a change in practice. We're seeing a 17-year lag time. That is a tragedy.
What needs to change so that, and I'll focus on the U.S. right now, so that physicians and hospitals implement changes so that people aren't getting surgeries they don't need.